New at 4:30, after more than 40 years, Blue Cross and Blue Shield of North Carolina will no longer administer the state's health plan.
A new bid approved by unanimous vote gives Aetna the role of third-party administrator for North Carolina beginning in 2025. WXII 12's Bill O'Neill reports for 12 Investigates.
Blue Cross oversees healthcare coverage for more than 500,000 state employees under age 65. But 2 years from now, its longtime contract with the state will come to an end.
Was there a particular problem that you guys saw, your board, that said, hey, we need to make a change here?
Well, the particular problem is, and I can't talk about this too much because we've already been told that they're going to be appealing this.
North Carolina Treasurer Dale Falwell, who oversees the state health plan, says one reason for the change is the lack of transparency from Blue Cross.
The plan auditors do not have access to the contracts and cannot verify that the state employees or the plan are receiving the proper contractual discount.
Are you saying that the new provider is more transparent than the old one?
What I'm saying is that we look forward to working with the new provider regarding healthcare transparency.
Blue Cross responds to the change with a statement saying, quote, "We are deeply disappointed by the state health plan's decision last month. This is a consequential decision that will impact more than 580,000 state health plan members and threatens North Carolina jobs." The statement from Blue Cross notes, in addition to seeking a formal appeal of the state's decision to change, the company is also seeking more information from the state through a public records request.
What information are they seeking through a public records request that they couldn't get just by asking your office?
Well, I'm highly disappointed because I was on a Zoom call yesterday with the CEO of Blue Cross Blue Shield and the chairman of the board.
Blue Cross did not provide any details about its public records request. Treasurer Falwell says a state audit completed a dozen years ago warned, quote, "The plan is at risk for overpaying medical claims," noting that auditors could not verify if the state received discounts that were guaranteed under the Blue Cross contract. Falwell says the new deal with Aetna would save the state $140 million in administrative costs alone. Bill O'Neill, WXII 12 News.